Everybody, thank you for joining us this evening. My name is Paige Fairbanks-Gunn. I'm the Regional Relationship Manager for Koelsch Senior Communities. I've been in senior housing, a little over 25 years, and we have communities, independent living, assisted living, mainly memory care communities over 8 different states. I'm in the Arizona region, but I really want you guys to please reach out to me if you have questions. I work with families on a day-to-day basis that are struggling with decisions, trying to find answers, but also to help give you some relief of anxiety and fear of the unknown. So there are good positive things with this journey, and we can help you with that. And I'm just excited to have you here today. So please reach out. I'll put my information in the chat. You can reach out to me or call or email me or text anytime. And I also want to welcome my webinar partner. She is a national caregiving speaker and consultant. She provides a path to relieve the fear, anxiety, and overwhelm that family members experience when a loved one is diagnosed with dementia. She's the founder of Alzheimer's Family Consulting. She's a certified senior advisor, certified dementia practitioner, and is certified in dementia care. She's also the author of the highly rated It's Not That Simple: Helping Families Navigate the Alzheimer's Journey, which is based on Pam's 14-year dementia and Alzheimer's journey, caregiving for her parents. Please welcome my co-host, Pam Ostrowski.
Thanks so much, Paige. I appreciate it. And welcome, everyone. We're excited to be talking today about dementia symptoms and their associated stages. But what we're also going to do is make sure that we get your questions answered. And we're actually going to use our question format. And if you've been in our sessions in the past, we actually have done this session multiple times. And if you click on that link I just put in the chat, that's from our August 2024 session on this topic. And it is a slide deck of an hour of talking about each of the symptoms, each of the stages, and what to do in each of those situations. So we try to mix up the format because we've got a lot of fans that like to watch us and learn from us and our years of knowledge. And so we thought, we'll look at what are the most frequently asked questions around dementia symptoms and stages. And as promised, we will cover what we said on the landing page, which is we'll cover, which symptoms are truly dementia related, or could they be something else? And then the easiest way to understand the stages of dementia, basically you're looking at symptoms more than you are anything else. So don't feel the need to label your person and say, oh, they're stage 3. There's really no such thing. And Paige and I agree on this. It's early, mid, and late. And then really it's like, how do you prepare for each of those transitions? And we can talk a bit about that when we're answering these questions. So again, feel free to put your information in the chat to ask any questions. And we'll get started with the first question. Paige, are you ready?
I'm ready.
Okay. So does it matter what type of dementia my loved one has when it comes to caring for them? And by caring, it could be either at home or in a professional environment, such as at a Koelsch community, or, is there any difference in how they get cared for?
Well, there are some differences in how they're going to be cared for. Overall, we're going to do the best we can to manage their symptoms. Oftentimes we have people that come in that do have a certain diagnosis. They have been diagnosed with Alzheimer's. That, of course, is going to be, the progressional patterns of the memory loss. But there's also some people that come in with Lewy body type dementia. So we might be seeing some hallucinations, some shuffled gait, those types of things. So I think knowing some of the types of dementia is helpful. It's not absolutely necessary at all, but it does sometimes help us tailor some of the service plans and how to manage some of those symptoms to ensure the best quality of life.
You just brought up something. You just mentioned something that about service plans and care plans or plans of care. It depends on which community actually, what they're actually called. But does that mean that each individual gets their own care plan based on their symptoms and their behaviors and their desires?
Absolutely. Each individual resident has a tailored service plan to their needs and what managed needs we need to have. Is there what symptom management do we need to be implementing? What type of medications are involved? Do we need to back down medications? We've also had just some discussions at my memory cafe that I had yesterday that we're seeing a lot of people are starting to utilize symptom management with CBD and THC and those types of things. So, if those are things that family members want to bring to the table along with their practitioner and their physician, those are absolutely things that we want to bring to the table and make sure that this is not only us caring for your loved one, it is you being involved as a family member, and it's all around that we're making sure that everyone's involved in that tailored service plan.
Excellent. Yeah. And that, so just so you guys know, my mom was actually in a Koelsch community for the last 3 years of her life out in Surprise at Rock Creek. And the executive director there always emphasized that this isn't us taking care of your person and you coming in and visiting. We're your support team. We're here for you and your needs and what you think that, in my case, my mom, what her needs are. And so I really felt very comfortable with mom being at Rock Creek because it felt right. It felt like people cared about her, and she loved the people there. She was always hugging them, and they were always hugging her. And it's good to feel like your loved one is safe in a memory care community, and that they're loved and cared for because of that. And so that's something that we will be talking about a bit more in a bit. As far from my perspective as someone who's been a caregiver for 14 years for both of my parents. So my dad had vascular dementia and my mom had Alzheimer's. And so I had the pleasure, tongue-in-cheek comment, of seeing both situations. So my dad, I always called it angry paranoid dementia, because he would accuse people of taking things from his apartment, and he would get really angry and he would be upset if somebody didn't do things his way. Now, granted, he was a retired lieutenant colonel, so he had a bit of that going on too. So he was articulate, and his memory really started to go last year, a year and a half. But in general, he was able to have a complete conversation and ask you questions and remember your answers. So it was an entirely different behavior set. And vascular dementia is usually, so he had high blood pressure since he was 44. So, and my mom had high cholesterol, and so did dad. And so anything that affects the vascular system, the circulatory system that carries oxygen to your brain, which this makes sense, right? No oxygen to the brain, or less oxygen to the brain, means that it's not, the brain cells are going to die. So it was no real surprise that he ended up with vascular dementia. But mom's situation with Alzheimer's, her first symptoms were unusual anxiety, and then really a loss of words. So she couldn't find words, and then loss of the ability to follow instructions and to perform tasks. So it really became a stressor on my dad. So does it matter what kind of dementia they have? Mostly because you're in a situation where, if you're the caregiver, so dad took care of mom when the first 6-7 years of her life before we moved into a care community. And it was very stressful on him, and it was very difficult. And so we want to make sure that we're taking care of the caregiver. And so when we talk about different, if you do end up with someone who's angry and throws things and that kind of thing, you don't want your loved one to be in that environment. That caregiver being, there's safety risk, there's emotional damage that happens. It ruins the relationship. So does it matter? It depends on what situation you're in. It seems like we say that a lot, Paige. It depends. But it really does. If you're just a person living alone and you you want to live alone, then it's like, well, okay, but do you want to explore any other options? So we're here to help dispel some of the fears and mysteries and what I might say misrepresentations of care communities, because they're not homes. I mean, if you guys ever get a chance to tour one of Koelsch's independent living facilities or communities, they're like a docked luxury cruise liner. So and a lot of stimulation and activities. So that's a good thing. Okay. Paige, what's the next question?
All right. Next question is, I see these commercials for Alzheimer's drugs and the symptoms look scary. Are they real? No sneaking up on anyone. Yep. Are they real? There you go.
Are they real? So, yep, she started to read my response. I put my notes in there just to make sure.
Sorry.
It's okay. So I don't know if you guys, I think it's Lequembi that you see the daughter says, Mom used to be fine, but now with her Alzheimer's, she acts unreasonably. And they show the mom is standing with her back to her daughter, and the daughter comes up behind her and puts her hands on her shoulders. Well, I'm sorry, but if somebody did that to me, I'd be upset too. And as we get older, our reaction time, our fears, the way that we react to surprise is very different than when you're in your 20s or 30s. And so the fact that they show that is inaccurate. And then they talk, the commercial talks about, mom is unreasonable and she gets angry and she even, hits or yells or starts crying. And yes, if you trigger someone, the question I would have for whoever created that commercial is, you're missing out on telling the truth about triggers. And typically, if somebody is, sensitive and somebody says something to them, they might burst into tears. And it doesn't have anything to do with dementia or Alzheimer's. And so be careful what you believe on TV. Please don't watch those commercials and think, oh, that's what my mom is going to be like, or that's what my dad or my spouse is going to be like. And it's like, no, every journey is unique. And they're also creating that environment to sell a drug, right? So it's the pharmaceutical companies trying to encourage that. What are your thoughts on that commercial or those type of commercials, Paige?
The commercials they're very dramatized to push treatment, in my opinion. And for all of the caregivers and clinicians and nursing and certified CNAs, certified nursing assistants will all tell you that, of course, if you come behind somebody and you're going to startle somebody if you come behind them. So it's always best to approach at eye level. Someone is in a wheelchair, you need to come down to their level. And also too, there's they can't hear very well and their vision is tunneled. And so that's just going to startle someone again. So really the commercials are dramatized in my opinion. And really selling those commercials, the approach that they give, it's very dramatized and it's all in the approach. So I'm not a big fan of the commercials because it scares the spouses. It scares the people that have been just diagnosed. And it scares, someone that's just been diagnosed with, mild cognitive impairment or early onset Alzheimer's. That has to be really fearful. So it's always best to always consult with your healthcare provider.
Absolutely. And I'm a strong advocate of neurologists because they're the brain guys, right? So your PCP is going to do your tests and that type of thing, but it's your neurologist who knows how the brain functions. And any good neurologist will tell you that the symptoms are different for each individual. Like, for instance, my mom lost her words, but she could understand what I was saying. And then she would react to that. So, it's not, they're always in there is the one thing that I would emphasize as we're talking through the different stages. So, don't be scared by these commercials and the symptoms that they're showing. So, Paige, ready for the next question?
Yes.
Okay. Let's see. Sorry, we already did that one. What symptoms am I looking for to know it's time to talk with my parent or spouse about later in life living arrangements? So what do you see in your clients when families come in? What do you advise? Like, when do we have to make this decision?
Well, there's a lot of key signs that are out there. Forgetting to take medications. You go and you fill mom's pill
Huge.
box, and there's no medications taken, or they've overtaken them. That's a huge key indicator. We start to see slip up in personal hygiene. Mom or dad was always showering every day, or they were very, had everything together. They looked together, and now they're looking very disheveled, and maybe there's an odor going on. They're wearing the same clothing. Those are definitely key indicators. Also, too, if your parent or your spouse or your friend, whoever, if they're withdrawing from social activities. So being isolated and withdrawing and not wanting to be in certain social settings because they're fearful of maybe having to answer a question. So
Right.
those types of things. And then also falling, if they're falling, that's a huge indicator that there's something going on. Maybe there's a urinary tract infection. There's all sorts of things. Food in the fridge, expired, they're not eating, losing weight. So those are
Yeah.
there's a lot of things to look for.
Yeah,
And you, with your
absolutely.
mom, you would ask, and you can talk about, how would you have for lunch today?
Yeah.
you know?
Yeah. Well, and that is exactly the question when you look at this individual that you're concerned about, asking them very detailed questions.
Mhm.
So what Paige was referring to is I would ask my mom, oh, did you guys have lunch? Oh, yes. Well, where'd you go? Oh, the same old place. And well, what did you have? The same thing I always get. So she never answered the question, or your dad and I split something, because that way she didn't have to answer the question. And I fell for that many times. And it's interesting when we're going to do a webinar on family dynamics when a loved one has dementia. And one of the biggest challenges is when they use those generic responses, kind
Mhm.
of to dismiss you and get the conversation moving away from them. Most of the family will think that they're just fine and there's nothing wrong with them. And then that creates that whole issue of, well, there's nothing wrong with mom. Why are you even looking at care communities? And that brings me to, it's fine to look at symptoms, but here's the thing. If you're in your 60s, and definitely if you're in your 70s, you need to go visit some care communities and get the
Yes.
fear out, because sooner is smarter. Now,
Mhm.
I have clients who, are like, well, we're not ready yet. And it's like, well, you're going to wait until a crisis happens. The person's going to be in the hospital. They're going to dismiss them to rehab or skilled nursing. And that you really don't want that. And then those people are going to turn around and say, well, where are you going next? You can't go
Right.
home. And now you've got a weekend. Paige works weekends
Yes, I
because
do.
families are like, well, we can't take mom home, or we can't take dad home, and we need to put them somewhere, which is also kind of a weird way to word it, right? It's we need to find the next home, the next living arrangements, so that this person can be cared for properly by nursing staff and caregiving staff, and a group of people, more eyes on, because
Mhm.
there's no way, if it's just two people at home and you're going to have to go to the bathroom at some point, you're going to have to go grocery shopping at some point, you're going to have to leave this person alone. Are they safe? And so when we talk about, when do you start having this conversation? Now. I don't care how old you
Yes.
are. You really need to start having these conversations and, going around and checking out some of the communities near you to see what you think. And I will tell you, I know I'm from Phoenix. I'm in Denver now, but in Phoenix, there's over 1,400, probably more now. This is information is probably from last year, but 1,400 different locations for someone to live, either for independent living, assisted living, or memory care.
Sure.
And so what's your vibe? Do you want, and this is a decision you can make now for yourself for later,
Mhm.
and document it. especially if you have children, but even if you don't, help your spouse out and put this in writing, right, Paige? I mean, you get people coming in who are like, well, we didn't know what he wanted to do, and that type of thing. And it's sad because the family is fretting, they're overwhelmed, they're scared, and they're not sure that this is what a loved one would want. And it's like, well, if you want care, then you've got to make sure that you're not the only caregiver. That it's just too stressful, right?
It takes a village.
It really does. It really does.
Yeah, it really does. Okay, Pam,
Yes.
How do I know if my parent has dementia or if it's just normal aging?
Well, so let's think about this. As we get older, and this starts in our 30s, so that ship sailed a long time ago for me. Our brains shrink. I mean, that's just the thing. That doesn't mean that we have Alzheimer's. It just means that naturally everything is kind of slowing down a little bit, and our thought process is slower. So that means when somebody asks you a question, you take a little longer to respond, which means everybody who's asking those questions needs to take a chill pill and wait for you to respond. So that's normal aging. So if I walk in the door and I have my sunglasses on my head and I have my keys in my hand and I'm on the phone and I set the keys down and then I walk into a different room and then I hang up the phone and then I'm like, oh, where did I put the keys? Where are my sunglasses? How many of us have walked around with our sunglasses on our head, wondering, searching the house for them? So that's an unfocused issue. That is, we have too many things going on. It has nothing to do with aging or dementia. And so in reality, it's because we're doing too many things at once and we're not paying attention to what it is. Like, mentally, what I always, I usually say it out loud is, okay, I'm putting my keys on the kitchen counter, or I just set my sunglasses down in the bedroom, or I make a mental note of it and say, okay, my sunglasses are there, or my phone is on my bed, so that you can remember that. But the bigger challenge comes when you start having issues with asking the same question repeatedly. So that means short-term memory is going. And if an individual is struggling with finding something in the kitchen or putting their shoes on or doing any sort of typical daily activity of daily living, and you'll see that abbreviated ADL, activities of daily living. And if they're struggling with that, it's like, okay, there's something wrong here. There's something that we need to go to the doctor and find out what it is. But those symptoms are what start the ball rolling in a caregiver's mind about, well, what happens next? And here's the thing, we don't know. Because my mom's Alzheimer's was different than my dad's vascular dementia, which was different than anybody else's experience, right? So we can't jump to conclusions that just because we saw, like a lot of people will go on Reddit or Facebook groups and say, my mom did this, what do I do? And 20 people will respond with their situation and what they did. Is that good? I don't know. I think that it can be very misleading. And the whole idea behind these webinars is to provide you with accurate knowledge and information based on experience. And that way you can decide what your options are and what the best course of action is to take. So, I think it's just really important to understand that there's a lot of factors that affect dementia symptoms. And there's also something called pseudodementia. And I consider them dementia influencers. So and as we get older, Paige, this, especially from walking around independent living, is nutrition, hydration. Somebody comes in, especially men, by the way, aren't drinking enough water. And then when you get to a community where they're pouring you water all the time and there's water accessible and other people are drinking water, your peer group is drinking water, all of a sudden you start to drink more. And so, not alcohol, the other kind of drink, water, tea, coffee. So So nutrition and hydration are so important for the brain. Exercise, so more oxygen to the brain. So if you do have high cholesterol or heart issues, getting your heart rate up gets more oxygen to your brain. It helps with those symptoms. And then stress. So as we get older, we stress about different things. We don't stress about work because most of us are retired, but then the flip side of it is we might stress about our adult children and our grandchildren or great grandchildren or the news. God forbid, please don't watch the news. So there's stressors there, and we have to learn how to step back, go for a walk, be out in nature. Those are all common recommendations for take a hot bath or hot shower, ways to decompress. And we have to use those on a regular basis because we live in a crazy world. The world wasn't like this 50 years ago. And so there's so much going on. And then the next thing is sleep. So if you're sleep deprived, your brain isn't functioning at full capacity. So that's another influencer for dementia-like symptoms. And then hormones and toxins are also, so men have hormones too. And so getting a hormone check through your physician is always a good idea. And toxins, we breathe in all sorts of interesting things, depending on whether there's a wildfire or, anything else going on. And so ultimately, all 7 of those factors can create dementia-like symptoms. So I don't want anyone to jump to the conclusion that, oh, I saw mom during the holidays and there's something wrong with her brain. I bet you she's got early stage dementia. And to jump to that conclusion just based on someone who's trying to cater to a whole bunch of people during the holidays, which are already stressful, odds are she's not eating, drinking properly, or sleeping properly because it's exciting and stressful all at the same time. So I highly recommend, and Paige, I'd be interested in your viewpoint, do not evaluate a loved one's mental capacity or their mental health during the holiday seasons, any of the holidays, anytime there's a stressful event. What do you think?
I agree with you, Pam. It's very stressful. They're trying to, really hyper focus on being the best that they can be. There's too much going on. The best way to really evaluate, now you might see some things. It doesn't mean don't be concerned, but if you see things during a very stressful time, such as holiday or a big family reunion, make sure that you follow up and really assess them in a very calm environment where they're comfortable and it's more one-on-one with them, just to really kind of see what's going on, so you can get a better you can kind of compare the two, so to speak. But yeah, I think that as far as do you know if your parent, if it's dementia versus normal aging? I mean, Pam, you really hit it on the head with everything. We do forget things. I mean, there's times I have to go out and I'm like, well, okay, especially during the holidays, I'm like, okay, I parked here. Where did I park? And I mentally just slow down myself and go, okay, I parked here. Because if I don't, I don't know where my car is. I have no idea where my car is. So
it's the white one.
You're right. It's the white one. Well, in Arizona, every car is white. So, that I'm really in trouble. But, it's when they start having trouble with familiar tasks that are day to day that they're used to, that's usually a key indicator. If there's problem solving tasks that they can do that they've always been able to do, that usually becomes, a little bit of a, an alert to be more in tune. Yep. Finances, food in the refrigerator, things like that. So those all kind of come into play, but we do have some good questions.
Yeah. And so the other thing that we promised we would talk about is like, what do you do when the person's at that particular stage? And so I wanted to touch on that. So if you have someone who's struggling with finding the silverware and the cups and the plates and the coffee, we want to maintain as much independence as possible because you want the brain to work. And the first thing everybody wants to do as caregivers and family members is take over. Here, I'll just do it for you. Well, and I will admit I did that too with my mom because I was always the superwoman coming in and trying to make things easier for her. And that wasn't a good idea, and I wouldn't recommend it. And I wish I hadn't done it, but it's bygones be bygones. So the thing to do is help the person by using visuals. So you can get stickers, or you can go online and search for images of cups and saucers, plates, silverware, and then cut them out and then tape them to your respective cabinets and drawers, so that the person can actually visually, because they're going to keep visual acumen longer than they will audible. So telling somebody, the plates are in the other cabinet, it's like, okay, what's a plate? Because they might be struggling with the words that you're using. And so to them, it's like, what's the round thing you put food on, right? So by having visuals around the house, especially as they progress into mid-stage, having, like, where's the bathroom? It's really important to have a picture of the toilet, or, some cute 1950s cartoon type thing that, makes everybody chuckle. But it's also a visual indicator that is not a closet, that's the bathroom. And the closet is for hanging clothes. And because I've unfortunately heard of people getting the two confused. And so it's not done intentionally. The individuals are not doing anything to upset you personally. They just can't help it. Their brains aren't functioning, and they get frustrated, and then they get angry. And then you turn around and say, well, what's wrong with you? This isn't, how do you not know that? And we as caregivers tend to get stuck in the past, who this person used to be. They're evolving, and you have to evolve with them and appreciate who they are when they wake up in the morning. And that's the person that you know and love. They're still in there, but some of their behaviors are changing. And we have to accept that, because that's the only way that we can truly show our love and care and kindness towards them. So this, no matter what stage they're in, no matter what symptoms the person's showing, coming to the table with compassion and kindness, and honestly, a sense of humor, being able to laugh and go, well, that did not go the way we thought, did it? And I have clients who say, you know what? When my loved one passed, we had the best laughs the past year, and we just didn't take anything too seriously. And I think that's part of the problem, is we tend to take things too seriously. And is the disease serious? Sure. But do we need to deal with it in such a serious manner all the time? No. It comes down to perfection is a myth, and we're just going to do the best we can. And that's a better mentality to have for both you as a caregiver, as well as for your loved one's own personal mental health and for your relationship. Would you agree, Paige? Do you have any thoughts on that and how to kind of handle these stages?
Absolutely. They
Oh,
always respond.
can you get closer to your mic? You sound really quiet.
Can you hear me?
Yep, there you go.
Okay, sorry about that. They always respond in kind. It's always best to be kind than to be right. It's all in the approach, and they are struggling with making decisions, and it really is about the caregivers and us as care providers and caregiver yourself, Pam. History is we have to change our behavior.
Right.
We have to change our behavior
because we have control over that.
Correct. And they don't. So it's a lot of, well, do you remember when? No.
Right.
It's, I remember when. I remember,
Exactly.
Mom, when you used to do this, or I remember, Dad, when we used to do this, and do a lot of storytelling and asking, talking about stories and, and things like that. And that will help them feel comfortable and help alleviate their anxiety and some of the fears. Because it really is in our attitude and our approach to them.
I agree. And it's almost infectious. So they're going to mimic whatever behaviors you're showing. So if you're sad and and, isolated, they're going to be sad and isolated. So just keep that in mind when you interact with them, that, whatever, if they're behaving a certain way, they're probably mirroring what they see in you. So, there's something to pay attention to. All
Body
right.
language is huge.
Yep, absolutely. So Paige, the next question is, can my parent live in assisted living during early stage dementia? So where do you draw that line? Who gets to draw that line? To maybe talk a bit about assessments and that type of thing too.
Yes, so absolutely. And Judith had a good question that will lead into answering that question. Judith, that's a good one. So absolutely, somebody can live in assisted living with early stage dementia. So really, and they can live in assisted living with moderate stage dementia. It really just depends on what is going on with what tasks can they do and how much do they need help with those daily tasks. Because what happens is in a regular assisted living without dementia support, the staffing is a little bit different. So there's not usually as much staff. So are they able to, be helped with certain, with limited staff? But it's also catered service plan. We need to make sure, are they safe? Are they getting the necessary care that they need? A lot of times people with early to even moderate stage dementia, they just need a little bit of cueing and prompting throughout the day to do the task. So as long as that they're still capable of doing that with someone kind of one-on-one, giving them task per task to do each on, every day, then they can absolutely live in a regular assisted living. My husband's aunt was in a regular assisted living until the very end. The one thing that would not qualify, and there's a question from Jude that says, do they have to be in a locked facility? So do they have to be in a locked community? It just depends. So what would determine them to have to be in a I call it a secured, I hate to say locked, that sounds awful, a secured and safe environment is if your loved one is ambulatory and they are starting to walk and to wander, possibly outside. Maybe they're in assisted living and they walk out the front door and they're out in the parking lot at 2 o'clock in the morning. And maybe there's a busy street across the parking lot. So those are the things that would determine, okay, we've got mom is now starting to wander out of the community, the regular assisted living. We need her to go into more of a, secured, safer environment to where she can wander all over the community, but not wander outside. So
in your case, though, you have beautiful outdoor gardens and that type of thing. So they can still go outside, but they're still in the perimeter of the
correct.
Community.
They're just not wandering out in the unsafe parts
in
of
the public area. Yeah.
Correct. Yeah. In our communities where they're all one floor, we're purpose-built memory care assisted living communities. So they can go anywhere they want in the community, go outside, have the beautiful courtyard, and it's their home. So they can go and tootle and do whatever they want. But they can be in assisted living on the flip side if they're not wandering or a flight risk, so to speak, or an elopement risk, and there's not the big safety problem there. People can live in assisted living for a very long time with dementia in a regular non-secured assisted living. It just really depends. It just depends. And every person with their stage of dementia is a little bit different. Some are really on the go. Some are content with just caregivers, escorting them to activities, and they're fine in a group and they're not wandering off. And then we have some that are, they're ready to get in their car and they're ready to go, or they're ready to go to work, or they're going back 20 or 30 years and they've got to go pick up their kids from school, or they're going back, they're reverting. And so that's where it becomes a safety concern if they start to wander out the front door. So that would determine, a secure community versus a non-secured. So it just depends. And sometimes the behavior doesn't happen at all. And then all of a sudden, out of the blue, it happens. Yeah. And then that's where the community has to say, okay, we have a safety concern, and safety is key. That's number one. They have to be safe.
Yeah.
Yeah. What about you?
Excuse me, I'm looking at Judith's next question, which is, isn't aging at home as long as possible best?
Yep.
It depends on what the word best means and whether or not there's somebody else living with you. As far as aging at home goes, as somebody who coaches on dementia on a regular basis, one of the things that we talk about constantly is stimulation. That can be audible stimulation, scent stimulation, visual stimulation, touch stimulation. And the problem with living at home is that most people will just sit in front of the TV. They don't have activities. They don't leave the house. They don't engage. And that actually increases the speed of degradation of the brain because it's not doing anything. It's bored. So it's just shutting down. And so staying at home alone, I would not advise it unless you are getting out and about, you're going to exercise, you're going to tea or coffee or dinner with friends, you've got a book club, you've got an active life. But if you have no life, then staying at home is not a good idea, because if you tour some of these communities, I know many of the independent living and assisted living have pianists come in. They have vans that take you out to the symphony and the theater. And those are things that you would miss out on if you were staying at home, because that means you have to drive, you have to coordinate driving, you have to get an Uber, whatever. It's harder. But if you're in a community, you've got peers who are like, oh my gosh, did you like the show last night? It was fantastic. And you've got meals prepared for you. You've got housekeeping done for you. You've got your laundry done for you. I mean, you have staff. It's like being extremely wealthy.
Yeah.
But
yeah.
And you don't have to hang out with people. They have libraries and private places to hang out. And you've got a private dining room for your family when they come. And so there's a lot of benefits to figuring out what are the symptoms, where are you, what's your definition? I would say, what is your criteria for, hey, it's time to downsize and move? Although, my parents were in a 2-bedroom apartment, 2-bedroom, 2-bath apartment. And so, we did good to fill it with their stuff from their 1,400-foot condo. So, it's big enough that you can move around. So it really comes down to what's best. And the thing that Judith had asked about is, well, what if you don't have anybody? And, you're all by yourself. Well, I'm right there with you. And that's the scenario I'm talking about, is if you want to live a good, long, healthy life, we're talking health span, not lifespan, then you have to have an active life, because your brain will start to shut down. And you may not even know that it's shutting down. You may over-medicate, under-medicate. Somebody finds you somebody, we don't know who, would find you on the floor and take you to the hospital, but you haven't written down any of your wishes or what you're looking for. So other people who don't know your wishes and wants will make decisions for you because they can. So write this stuff down. All right, we should probably finish up with the questions so that was Judith's question. Diane has
that was a good one.
Yeah, it was a very good question. So Diane has a question. Do you want to take that one, Paige?
Yes. There we go. Okay.
Mom is 92.
Oh, got it. Sorry about that. Okay. Mom is 92. Let's see. Mom is 92 in a memory care community. And why is that? Sorry, I'm having a hard time reading it here.
I'll read it for you.
There it is. There it is.
Okay.
Has a great PCP, but no neurologist. Does she need one? Does she need a neurologist, mobile and only on one blood pressure medications, no other health problems? If your mom has a primary care physician, and I mean, if she's not having any symptoms of aggression or anxiety or severe depression or behaviors going on, I wouldn't see the need for a neurologist. But if she's obviously has dementia, she's in a memory care community, so the PCP can handle just about anything in a memory care community. Our mobile physicians are they're very experienced with all different types of dementia in our assisted living with memory care support. So I think you're probably fine with just letting everything be handled under the primary care.
And the
Unless, yeah,
a neurologist's job is to, basically order the MRI. The MRI indicates Alzheimer's due to
right,
the shrinking brain and the dark spots. And then that's about the end of their role.
right.
They don't know what to do with the caregiver. They don't know there's no cure, there's no treatment. And so now it comes down to, how do you prolong and build the independence in that individual for as long as possible? Because we don't, the average lifespan after a diagnosis is 4 to 8 years, according to the Alzheimer's Association. So you don't know how much time you've got, but by getting out and exercising. So Ms. Hessler, I'm going to answer your question as part of this, which is get out and go for a walk. Exercise will help your loved one get visual stimulation, audible, like if you go to the Riparian Preserve in Gilbert, I don't know where you're from. If you're in Phoenix, there is a beautiful place. But go to a place where there's birds, basically bird sanctuaries, a zoo, some place where it's not just you're just walking in the same place. Do not let your loved one walk by themselves. A lot of times I have people clients who will say, oh, well, he walks the dog. And it's like, but the dog doesn't know how to get home either. So how's that going to work when they get lost together? And so you want to make sure that you take time to do activities. Now, the question was about what you're having difficulty finding ways to engage the individual, loss of ability to read and do hobbies, because you have to change what the hobbies are. So a jigsaw puzzle can be very interesting, but don't get the 1,000-piece puzzle, get the 100-piece puzzle.
Yeah.
Faith recognition stays with us for a long time. The other favorite thing is music. Go to a concert, go to the symphony, go to, and you don't have to stay the whole time. It's not, and there's lots of free concerts depending on where you are in the country. There's always free concerts of some sort going on, whether it's through a church or whether through another organization. There's also the Alzheimer's Association and the Alzheimer's Foundation of America both have a lot of activities, of things that you can do, planting seeds so that you can watch them grow each day and water them. Those are things that people mid-stage can still perform those tasks. Will they remember to do them? No, that's your job to help them remember to do that. But it keeps them stimulated. So Judith has more questions. Did you want to answer that, Paige? Do you want to?
Yeah, I'm looking. So she says, I have a friend whose friend of 27 years, only person in her life, died suddenly a year ago. I've been over there every day, taking her out for a run and social events. My goals were giving her wonderful experiences and making it possible to be in her home among memorabilia and pictures of mom and deceased friend. She started saying she didn't want to eat, but I took her out and we ate in her home. I just found ways to engage her. That's good.
Yeah, that's excellent. Good job. She's lucky she has you.
Yep. Yep. And taking her out.
Yeah. But I also think too, bear in mind that all that memorabilia is clutter. They don't necessarily remember the photos and what's in them. And sometimes, like my mom, after, mid-stage, couldn't see well enough to actually be able to process that was her family. And in other cases, she was. And by the way, just a reminder, if they have a bad day, they have a bad day. We all have them. So my mom would recognize pictures of her parents and she would kiss the photograph. And then other times she would just look at them like they were complete strangers. This is a very bizarre disease, and it fluctuates from sometimes hour to hour. Hopefully, not as much, but you're going, it's a roller coaster. In my book, I have a whole chapter on the emotional roller coaster, because they get better, they get worse, they get better, they get worse. You got to have to strap yourself in for this ride, because it is definitely extremely variable.
It's learning how to pivot and shift quickly at times. For sure. But
So
also another stimulator would be if suggestions would be if there's an adult daycare community in the area, that's also a good
senior
way to
activity
help.
center,
Senior activity center. If there's
memory
any
care.
memory cafe,
Mhm.
we have a lot of memory cafes, which are a support group in the Arizona area, and they're really
They're
starting to spread over the
nationwide.
country. Yep, they are.
Yep.
And finding one of those that way, the caregiver can go to the support group, and your loved one that you're caring for that has dementia will go into an engagement program. And usually it's music, or they're doing some sort of history class, and they're there to observe and listen, or they'll be playing instruments.
Mhm.
They'll be doing tambourines and, fun keyboard stuff.
Triangles.
So music is always think of music. When in
Yep,
doubt, think of
absolutely.
music. Hmm.
Absolutely. And it's okay to have quiet times too. I mean, that was one of the questions is, what do you do during quiet times? Oh, I don't know. You can listen to music. That's a great way to spend time just, relaxing. Judith said the POA found caring too burdensome and moved her into a facility with independent assistive. And oh, that's good. So they have all three, so she can progress.
Perfect.
Placed her into a secured part based on the mini memory. It's the mini memory state exam, where persons are nonverbal and staring into space. Okay, so the residency of memory cares evolve and change every day. Somebody passes, somebody new comes in. So just because there's people there who are nonverbal doesn't mean that it's going to stay that way. However, she's very unhappy, and I found out there's an ombudsman that can help her. So, if she's not, like what Paige mentioned, if she's not a risk of wandering out the door, she could go into assisted living where there's more stimulation. The other thing is find a different community.
Right.
A lot of times the first community is the one that person gets into because nobody wants to do the research. But finding communities that are committed to, like with mom had she was higher acuity, less capable, but at Koelsch they split them up into higher acuity and lower acuity. So some of the people can get around, they're mobile, they can have a conversation. They don't remember where the room is. Whereas my mom was in a wheelchair, nonverbal, but engaged. And then there were the people who stared into space because they're reminiscing about 20 and 30 years ago. They're not where they're sitting. So that's an important thing to keep in mind. Okay, we only have a few minutes left here, so let me. I'm gonna ask you a quick question, Paige. One of our favorites, actually.
One of our favorites, yes.
What is respite, and why would I need it?
Okay. So what respite care is for the caregiver to be able to get a break. So the definition, I mean, it's basically you being able to get care, whether that be, something that's under 30 days, a month, or under 30 days, a few weeks. I always recommend at least 2 weeks of respite care. Now, what that can look like is you have someone come into the home and give you respite care for home care, or to get full respite and fully unplug is I recommend that you go into an assisted living community or a memory care community for respite care for your loved one. So that way you can, and oftentimes it is for you to rest, but sometimes it's just for you to have time to go get things done. There's just no time for you to run to the bank or, go get your hair done or get whatever you need to do to get these things done. But I highly recommend that you spend 2 weeks so you have at least 1 week to get what you need to get done and at least start to unplug. And then you have a week of rest. And you can do it for 3 weeks. And sometimes if you want to just take it month to month and figure out, am I ready for long-term placement for my loved one? Because I've been so worn out. But another thing that I would highly recommend is when you do take respite, don't tell everybody that you're doing it. Because what happens is all your family members are calling you all the time. Are you okay? Is everything okay? And you can't really unplug. You just maybe tell one or two friends or one family member and let them kind of, navigate, so you can really unplug. But it really is time for rest and relaxation and for you to recharge your battery. And it's also a good way to give you a test a test pilot to see how your loved one's going to do in a community as well in that type of setting. How
So
about you,
Koelsch
Pam?
has some special programs though, don't they, for respite? Like you can do a day program and you can do
We, yep. So
what are those?
we have a minimum stay of 2 week respite stay if you want to stay overnight. But we also have
They want
another
to stay,
program.
they want their loved one to stay overnight.
They
They
want
don't.
their loved one, the one that needs the dementia assisted support. And then we also have in our assisted living with dementia support, we have what we call day stay program. And what that is they can come in for hourly care. So we typically sit down with the caregiver, the family, and say, okay, what is dad like? What are days that maybe you want to have him that you need to go run errands? Maybe let's look at Monday, Wednesday, Friday. Dad comes in from 10 to 2. He comes in during the high bulk time of the activities, has lunch with us, and we can give him care, medication, give him a shower while they're there. And it's just an hourly rate. And you come and pick them up, and it's
That's
just an hourly
awesome.
rate. So that's
That is
an
awesome.
option as well too.
Yeah.
So
And not everybody does that. That's the reason why I highly encourage you. I probably looked at least 10 different communities and I was shocked at how different they really are.
they
And
really
it's
are.
one of the reasons why it was mom's physician that recommended mom move to Rock Creek because of quality of care. And so ultimately it comes down to this person, what their needs are, and you want them to be in a particularly stimulating environment. So just making sure that they're in the right place, right? It's true
Yeah.
of, when you're picking a home and it's like, do you want one with stairs? Do you want one on one story? Do you want one with a 2-car garage or is it 1-car garage? It's the same thing. You wouldn't buy the
It
first
is.
house that you looked at, or maybe you
Right.
do, but at least you looked at a bunch of others before you did that.
You're
So,
right.
Ms. Hessler has said that her husband is a Koelsch, so that's very cool.
Oh, great. Okay.
Um,
Which
so
which state? I'm just curious.
yes.
Curious. That's it. That's
Oh,
good.
respite. She said respite. Bozeman, Montana. Okay.
Oh, Bozeman. Okay. I have my our regional Bozeman, our Montana nurse here in Arizona helping out this week.
Oh,
She's happy to be in Arizona right now
yeah.
because of the
Oh,
weather.
I
So
bet.
stay warm.
Yeah.
Yeah.
Well, we did have a few more questions, but I think it was really important to answer your questions over some of the other ones that we came up with. So if you have more questions, want more details, whatever, please reach out to me. I'm at Pam at itsnotthatsimple.com. So that's the name of my book. And my book highlights walking this journey from the very beginning, diagnosis, medications, all that kind of stuff, all the way through to the end. How to know when the end is near, and how to deal with the emotional roller coaster that is part of loving someone with dementia. And Paige, you want them to reach out to you as well because you represent the best of being able to become more knowledgeable about, give an honest opinion about what's good, what's not good, what is a community like, and like what Judith was saying, if the community doesn't match the person's needs, then it's time to move. And we
Right.
do discourage moving too much because it's very disorienting for a person with dementia, but that's all the more reason to do more research and to figure out what
Right.
the right place is for them.
And
So
oftentimes respite care, it's kind of that, I call it the not so good honeymoon period. So it's really trying to find out, pairing them up with other residents and also the staff too. It just takes time. So,
yep, exactly.
but
And definitely, getting to I think it's Judith's point
mhm.
about driving around. And that was
Yeah,
something that I loved about like Christmas lights and that type of thing. They would go on outings and they went, they would be taken
mhm.
to a restaurant. My mom would eat an entire burrito. Nobody thought she could do it. She was a tiny thing. And the caregivers were there and they could go out and they could eat normal. They could be normal. And they
Sure.
know what normal is, by the way. And they know that they're not. So thank you all
Exactly.
for joining us. We appreciate it. And next, we do this the fourth Tuesday of every month, different topics. So watch your email because I will send it out. I'll be sending out the recording within the week, and then we'll be sending out more invitations to the next webinar.
Thank you all for joining. Have a lovely evening. We appreciate your support.
All right. Thanks for coming, you guys. Tell your friends that we exist. Everybody needs some help these days. All right. Take care. Bye-bye.
Bye-bye.